Hey, it's me, Jen again, and today we're talking to 5 different thyroid-focused physicians on why the thyroid is so important and why it's worthwhile to save it, if you can. If you value this content, please subscribe to this channel because that really helps YouTube to put these videos in front of more people. And that helps more people be able to save their thyroid from surgery through radiofrequency ablation, a treatment that shrinks thyroid nodules directly and preserves the thyroid gland itself. Today, you'll hear from 5 different thyroid-focused physicians, all from different medical backgrounds and having different levels of experience. But in spite of these differences, you'll find that they all have one common goal. Let's hear from these doctors why the thyroid is worth saving. So Dr. Ragsdale, as someone who just recently brought this new procedure into your practice, I feel like you have a really fresh perspective on just how important it is to patients to be able to save their thyroid. I would really love to hear what you have to say about why you feel the thyroid is worth saving.
I've been treating thyroid problems and thyroid patients for over 20 years now. We've seen all sorts of innovation within the surgery realm, making surgery less invasive. We've also seen molecular techniques that have been utilized to help patients not go to surgery when they have a benign nodule. We've tried our best to save patients from going to surgery for a lot of years. The problem we have is with a large nodule causing symptoms, traditionally there's been no way to save it. The fact that radiofrequency ablation is now available, we can now shrink those nodules and still preserve normal function of the gland, and that's awesome. Patients are so excited about that. Patients for years have been coming in asking, can you just remove the nodule? But the procedure to remove a nodule that's within the gland can actually put more risk at the nerve to the voice box and cause other problems with bleeding. It's just not a good operation. So the fact that we can now target a nodule without treating the normal gland, it's just a great improvement.
That's awesome. You know, I can't tell you how many people ask me all the time, why can't they just take the nodule out?
Exactly. That's one of the most common questions I get, especially for a benign nodule. Everyone understands if it's cancer, it probably needs to come out. But for a benign nodule, you want to preserve as much function as possible.
The common consensus around patients who have seen thyroid RFA providers is that they want to do more to save it. They want to save the thyroid because it seems more important to them.
So many things, we train in a technique, we spend our careers perfecting a technique, and in my case, it's been thyroid surgery. When there's new innovations, new procedures available, then I think it's important for us to be aware of it, but for us also to make our patients aware of it, because it's really the patient's choice. There's pros and cons to each of the procedures, and so it's important for a patient to have those options themselves so that he or she can make an informed decision and do what's best for them.
Give me your elevator pitch for saving the thyroid.
Thyroid just makes one hormone in 2 different forms. And you can take those hormones in the form of a pill. But when you think about that gland in your neck, number one, it works on a feedback system. And so it doesn't always produce the same amount every day under every circumstance. And when you take a pill, you absorb that pill, and then as you absorb that pill, it begins to get into your system, but you only take that pill once a day for most people. You can't take it 24/7, and so no matter how good we get with the replacement, it is just never the same. And I'm sure, as you know, if you look at the list of what happens when your thyroid levels are too low, it's enormous. And when you look at the one where it's too high, it is also enormous, and it's a different kind of misery. We never quite get it just like your body works originally, where you make hormone 24 hours a day, 7 days a week. You make both the storage form, you make the active form. The ratios can change depending upon certain circumstances. Most people, they just get replaced with the storage form. And there's more and more evidence coming out that not everybody, converts storage to active in the same way, but also tissues don't all convert it the same way. So your brain, for instance, may be better at converting it than your peripheral tissues may be. And so those enzymes that convert the storage form to the active form they work differently in different parts of the body. So it's way more complicated than what we thought. It's not surprising that this research comes along. We knew from years ago that at least 20% of the people on hormone replacement aren't happy. And in fact, I really got tired of my patients early on in my career saying, "You ruined my life. You took my thyroid out and you ruined my life." And you're like, "But you had thyroid cancer. You had a life-threatening condition." And they're like, "But I'm really not doing well." We've really worked hard we use 3 different models of how to replace thyroid hormone, and the same model isn't the same for each person. Sometimes it works out great and it's not a problem, but boy, there are some other times where it's just really problematic. And you never know what you're gonna get. But I promise you, whether you're on the really good end or the really bad end, it's still not the same as having your own self-regulating, 24-hour a day, 7 days a week adjusting thyroid gland. And we all know that. Every surgeon on the planet knows that, if they listen to their patients.
I believe that the thyroid is worth saving because even though there are thyroid hormone replacement pills available, nothing compares to our God-given thyroid, which works perfectly. And oftentimes after thyroidectomy, there's certain patients who will not feel 100% like they used to, even though their thyroid hormone levels are good on medication. Thyroid hormone is one of the 3 hormones essential for life, the other ones being cortisol and insulin. So it's so important to have a working thyroid, and my mission is to help save as many thyroids as I can.
Tell me why you feel the thyroid is so worth saving.
As you know, as mostly your work and the interviews you've done with other doctors have shown that there are a sizable percentage of patients who after surgery still don't feel the same. I can also qualify that statement now that we have done over 100 cases of RFA. I mean, I can clearly tell you that outcomes have been so good that just based on my experience and our institutional experience of having done over 100 cases like that tells us that it is so easy to recover from. Patients don't lose any time when they get this procedure done. And we have not had any case in which anyone has developed hypothyroidism or low thyroid hormone levels after this. And we have now follow-up with these patients of more than almost coming up on 3 years. So we have a sizable follow-up duration that we've had with these patients, which tell us that hypothyroidism doesn't develop, even in American cohort. Obviously, we have these studies from Italy and Korea and other places, but now we have our own experience to share with our patients, and we can tell our patients that yes, we can perform it as safely as the experts in Korea do. Now again, we haven't done thousands, but we've done over 100, and that's not a small number. Our results show that our volume reduction at our institute matches that of what they do in Korea and Italy. It is superior to what was shown in the Mayo Clinic study from 2 years ago, but that's because they were using a non-thyroid standardized antenna, and they were done in general anesthesia and other limitations, and that was not what they were going for. But our data, which was just submitted recently for publication, shows up to a 75% reduction in size, and that is enough to alleviate everyone's concern. So if you want to get this procedure done to alleviate your symptoms of compression and symptoms of cosmetic distress, of a mass jetting out of your neck, we have not had anyone so far who's not had a complete resolution of their compressive symptoms. And we've not had anyone who's developed hypothyroidism as a result of it. And the side effect profile also matches that we saw in other countries. The reason I suggest that this is something that you should consider seriously before surgery is because, again, no hypothyroidism, very limited complications, very efficacious results. Why should you go for surgery for a benign nodule? I mean, I see no rationale other than, if it's your personal preference.
Give me your elevator pitch for why you feel the thyroid is worth saving.
So I would say, as an endocrinologist that sees a lot of people who've had their thyroids removed, it is a really, really big deal to remove an endocrine organ that controls so many things in the body. It's very, very difficult to mimic that endocrine organ after it's been removed, for exercise and for fertility issues and for metabolism and weight and everything else. We do it and we really try to do our best, but nothing compares to the actual thyroid. That's like the main reason why it's so important to, do your best to kind of get people into remission when they have Graves' disease. Actually work hard to get people who are hyperthyroid into remission instead of just doing radioactive iodine or surgery. For surgical intervention, I mean, if you need it, you need it, but a hemithyroidectomy is always better than a total thyroidectomy, you know, and if you can make sure with like molecular testing, for example, for a biopsy that something is benign and not cancerous, way better to keep the thyroid gland and then just watch it by serial ultrasound. So for fertility, for metabolism, for, you know, peace of mind, for depression, for lipids, for blood pressure, everything. I mean, the thyroid hormone is one of the most important hormones in the body to keep it going correctly. We just do not have the tools to mimic it. If we had a thyroid transplant, that would be awesome, but we just don't have that. And it's such an important, like one of the most important organs that you have. I think it's a great idea to kind of put out the message to save the thyroid. I think a lot of people just go with the advice of their doctor and, you know, go for surgery without being counseled on how big of a deal that is, you know, long term, lifelong. Yeah. A lot of people regret it and they just didn't have the information that they needed prior to making that decision.
Isn't it awesome to hear these doctors say that the thyroid is important? I've heard it over and over again from doctors that the thyroid's no big deal to remove. Just take this little pill for the rest of your life and you'll be fine. But I've talked with so many patients who have experienced something completely different. Their life has gone downhill ever since they had their thyroid removed. I'm just so thankful that now we have an option, thyroid RFA, that allows people with thyroid nodules to shrink their nodules without having to lose their thyroid. So I'm so glad that this opinion is growing in the medical community, and I only hope that it will continue to grow and spread, and that more and more doctors will adopt this thyroid saving procedure. If you value this content, please subscribe to this channel because that really helps YouTube to put these videos in front of more people. And that helps more people be able to save their thyroid from surgery through radiofrequency ablation, a treatment that shrinks thyroid nodules directly and preserves the thyroid gland itself.